Welcome back. I'm visiting today with Dr. Jacob Eapen. Welcome to today's show.
Thank you.
So, Dr. Eapen, you're involved in the community, but you've also been involved in a lot of things throughout your career. And for the listeners, can you give us a history of some of the projects and things that you've been involved with up to today?
I was born and brought up in India, in the southern part of India, a state called Kerala. Did my undergraduation there, doctor, and did my post graduation there, and moved to Africa, where I was a consultant pediatrician for Aga Khan Foundation Hospital in Dar es Salaam, Tanzania, for 2 years, where my son was born. Then I moved to West Africa, in Sub-Sahara, in North Nigeria, where I was in a teaching hospital. I was a consultant pediatrician there for 3 years. Then came to Berkeley for my master's in public health, and subsequently I worked for the United Nations. I was the health advisor to the United Nations High Commission for Refugees to the Philippines, where I was responsible for about 60 to 70,000 Indo-Chinese refugees in the camps in the Philippines. Came back to the U.S. and did my second residency at Stanford. Since I had so much of public health background and international health experience, I wanted to pretty much stay within the arena of the public health. So as soon as I graduated from Stanford, I decided to work for a community health clinic in Union City, which is one of the largest community health clinics in the East Bay, TB Vasquez, and subsequently I became the medical director there. And then I moved on and I joined the Alameda Health System, which is the safety net public health system of the county. And I've been with them for the last 24 years, basically a pediatrician. And in the last 7 years, I've also become a medical director for the Alameda Health System. I live in Fremont. I've been in Fremont for 34 years. I have my wife here and 2 children, both are doctors. Sandhya, who was a doctor in Cleveland Clinic, finishing up a residency, and son, Naveen Jacob, was working in East Bay in the healthcare administration.
And your new grandfather as of last week.
That's right. Yeah, my daughter Sandhya had a baby, Isaac Chaco Schultz, was born about 5 days ago.
Well, congratulations.
Thank you.
So, most doctors simply work in a clinic or hospital, but you have very unique experience. You speak 9 different languages. You've been all over the world, in multiple countries. And can you give us some insight of what it's like serving as a doctor in Tanzania and Nigeria and the Philippines, and some of the things that you went through there, and also India?
The healthcare needs in most of these countries, I'm talking about the emerging nations like India and Africa and Southeast Asia, South America. I think the healthcare needs are pretty much the same, especially in children. I think the most common disease is infectious disease that kills more than 50-60% of the children, and a lot of vaccine preventable illnesses, which globally, because of WHO and other foundations like Bill Gates foundations, those vaccine preventable diseases are pretty much under control. But and then the second question is access in these countries. I mean, if you look at the ratio of doctors to the population, there's so much of variation across the globe. The life expectancy at birth, one of the best countries, or the best indicators of that is Morocco, which today any child born in Morocco is expected to live up to 89.1 years.
Wow.
And they have about 60 to 70 doctors per every 10,000 population, whereas a country like Chad in Africa Life expectancy today, any child that is born today in Chad is expected to live 49 years. And the ratio of physicians to 10,000 people is zero point 0.4. So there's so much of disparity, and that is access. I mean, the more doctors you have, people have better access to healthcare, better preventive health, people live longer.
Dr. Eapen, we need to take a quick break, but after we get back, I want to move forward into what brought you into the Bay Area and some of the projects you're working on today. I'm visiting here today with Dr. Jacob Eapen. We'll be right back after these messages.
Grandpa, can we do chemistry? Papa, Daddy. Grandpa, let's do something fun.
We'll help you stay organized so you can focus on what really matters in life. Give us a call today and see how we can help you start saving taxes. Welcome back. I'm visiting here today with Dr. Jacob Eapen. And Dr. Eapen, in the first segment, we talked about some of the international experience that you've had in emerging countries. Very unique statistics about the ratio of number of doctors to people also correlates to life expectancy. I want to move forward, though, that coming to the Bay Area, first of all, what brought you here?
1984, I came to this country as a student. I came on an F1 visa. Uh, I was enrolled at University of California, Berkeley School of Public Health for my master's in public health. The reason why I came to do that was because of my experience in Africa and previously in India. I pretty much realized that public health and preventive health is the way to go than the curative medicine. And there were no schools of public health in India at that time. And so I wanted to come to this country. So I applied to John Hopkins and UC Berkeley. I got into both, but I opted UC Berkeley, and that's how I came to the Bay Area.
So, coming into the Bay Area, finishing your education over here, do you see vast differences between the emerging healthcare systems and what we have in the U.S. today?
It's very difficult to make a generalized classification on healthcare systems because there's so much of variables around the world. If you look at countries like Cuba, where 91% of healthcare is done by the government. If you compare the same thing to US, uh, it's only about 50%. The remaining 47, 48% of healthcare delivery in this country is private sector. But then if you take countries like Canada and United Kingdom, which the healthcare system is pretty much nationalized, it's all government. So there's so much of variation between this, and there are a lot of debates which one is better, which one is more accessible to people. Um, where public health access is much easily available, like I said before, the healthcare indicators are much better. Uh, some of the poorer countries, it doesn't have to do with per capita income. There are some of the poorer countries like Cuba, Costa Rica, Sri Lanka at some point of time before the Civil War, China, and the state of Kerala in India. They all have had excellent healthcare indicators, in spite of the fact the percentage of GDP that was allotted for healthcare was much, much lower uh, than some other countries like America. In US right now, we spent, I think the latest numbers are about 20% of the GNP goes into healthcare. So per capita, we spend about $8,400 per capita for healthcare expenses in this country. And there's no one that is even close. I think the closest probably would be France, which is about 11. And then if you look at Canada and the United Kingdom, it's probably about 7 to 8%. And if you talk about some of these countries that I mentioned before, like Costa Rica and Cuba, the state of Kerala, it's less than even 1%.
So I could, in your opinion, do you feel that the U.S. is ripe for healthcare reform, or do you feel that we're on the right track right now?
No, I think it is some reforms have to be done because the escalating costs, you cannot keep on going up this way. It was 17% about 3 years ago. Now it's almost touching 20. What happens with that is, with increased costs in healthcare, to me, the access becomes less and less. The affordability is less. So definitely there should be some changes. But how do you make changes? That's a very, very difficult question to be answered. Obama, in his previous administration, he tried to make some reforms. Before that, during Clinton's administration, Hillary tried to make some reforms. Uh, so there's no right answer in any of the reforms. I think it'll be an evolution before we have the perfect, health system.
Mm-hmm.
But the answer to your question, does it need some reforms? Yes, absolutely, it needs some reforms.
I'm visiting here with Dr. Jacob Eapen. And Dr. Eapen, we need to take another break, and we'll be right back after these messages.
Grandpa, we found the golden stone.
We have to watch out for the treasure guardian.
Oh no, the treasure guardians!
Since you can't take your wealth with you, spend time with your family. Growco, servicing family office needs since 1964.
Welcome back. I'm visiting here today with Dr. Jacob Eapen. And Dr. Eapen, you serve a lot in our community, not only on the local but the state level. And I'd like to talk about some of the advisory boards or hospital boards that you've served on, and let's start with the statewide.
In 2004, I was publicly elected into the board of the local community hospital, which is Washington Hospital in Fremont. So I've served in that board for the last 14 years. I've been reelected 5 times. The 5th time was just 2 weeks ago. But during my tenure in the Washington Hospital Board, I've also served on the state level boards representing the Washington Hospital. There is a Association of Healthcare District board in Sacramento, which represents all the district hospitals in the state of California. The district hospitals in California were formed or initiated after the Second World War, when veterans were coming back, and district hospitals were a mode by delivery of health system to make it much easier for them. So the healthcare district is slightly different. It's just not one city. For instance, for the Washington Healthcare District, it is Fremont, adjacent cities like Newark, Union City, a part of Hayward, one zip code, and part of Sunol. So it's slightly different, and that is pretty much all across the state. So the representation in the state level, I've served there for 2 years. So I've also served in the advisory board of the California hospital system, which pretty much represents all the hospitals in the state, which is about 500 plus hospitals. The advisory board is mandated to have one physician from northern part of California and one from southern part of California. And I was the representative for the northern part of California and served in that for 2 years. I've also served in the advisory board of School of Public Health at UC Berkeley. I think it was a great honor as far as I was concerned, uh, 30 years after I graduated from the university, uh, to be nominated into uh, advisory board of the school that I started. I think it was a great honor.
So when you're doing service in the community, let's look at Washington Hospital. There's been a lot of initiatives recently that have been put in. Uh, the Center for Joint Replacement, the critical care facility. As a board member, what are some of your primary responsibilities in terms of giving oversight to the stewardship of the hospital?
We have 5 elected board members, and this is probably the longest lasting board. I think this board has been together for 14 years. No, none of the members have changed. And I think that has tremendously helped, because when you make strategic planning, some of the planning takes 7 to 10 years to materialize. And when you have the same set of board members, I think it's much, much easier to make decisions for such a long strategic projects. Uh, we have done extremely well in the delivery of healthcare in this part of the world. Washington Hospital is now ranked in the top 100 hospitals in the country, which is not a easy achievement. And some of the specialties like joint replacement, we have been selected by Health Grades as a top 5 percentile in the country. And we have a lot of other initiatives, the stroke program, the cardiology center. In a lot of specialties, we have been ranked very, very high. And now we have opened our new hospital, Maurice Hyman Critical Care Pavilion, which is new emergency room, new ICU, new CCU, and quite a few beds. The emergency room, what we had in the past, was very cramped. The emergency room is the second. Our emergency room is the second busiest emergency room in the county, after Highland Hospital, and so space was very critical. So now we have just moved to this new building, which has got about 40 beds in the emergency room. Having said that, we are also hoping that we can convert this emergency room into a level 2 trauma center. If you look at the nearest level 2 trauma center going south is Regional Hospital, which is in San Jose, which is about 20 miles. And the nearest level 2 trauma center moving north is in Castro Valley, in Eapen Hospital, which is also about 20 miles north. So between these two, in the 40 miles sector, if someone has a major car accident or vehicle accident, they have to go to one of these places. So I think we and the board feel that it may be very critical to have a trauma center, so that the people in this community could be served better.
Been visiting here today with Dr. Jacob Eapen. He is currently serving as a board member of the Washington Township Healthcare District. And Dr. Eapen, it's been a pleasure having you on today's show. Now, we will have on today's show, it will play back on our website at mypast.com. If an individual wants to contact you, are they able to do that as a board member, and how would they go about that?
We do have access. I mean, mostly it is, if you call up the hospital, we have a board secretary who takes all the messages, and the messages are passed on to us. If it is on a personal level, of course, people have access to, the emails, and that is another way of contacting. But any official, this thing is mostly through the hospital.
Okay. All right. Dr. Eapen, thanks for being with us today.
Thank you. Thank you for having me.